Well, Dr. Riopelle, here we're back again, and let's talk a little bit more about acne. Let's just assume people have had acne a year, 2 or 10 years ago anyway. There seems to be a tendency for them to get scars. I mean, almost it looks like irremovable scars. Are they really irremovable, short of like heavy plastic surgery, or is there other little things one can do? And do they really develop? Are those really acne scars, or is this just something else? Tell me.
Well, actually, acne scars is, to me, one of the most gratifying things to treat because we can do such great things nowadays with the technology that we have available. We can treat, there are different types of acne scars, and yes, they truly are acne scars. What happens is it's typically cystic acne, and the acne puts pressure on the collagen, sometimes destroying the collagen, creating divots or dents. And it also puts pressure on the surface, which pigments the surface. So you get a combination of reds and browns, coloring the surface of the skin, and indentations and ice pick scars and so on. Now we have several types of treatment, and we mix and match. In our office, we have about 15 different lasers, so we can mix and match the right laser for the right type of acne scar. For example, for the browns and the reds, we'll often use a photofacial treatment. A series of facial treatments will clear that up very nicely. Or we use our fractional CO2 laser. What fractional CO2 laser is it's a laser that punches little holes in the skin surface, microscopic holes. And then the skin actually grows into those holes, so you get new skin growth in that area. And that has great effects on acne scars. It can treat the browns and the reds, but another advantage is it also treats the ice pick scars and the dents. And little by little we can get regrowth into those dents, which clears up the scarring and makes the skin much more smooth and natural. So that's another great technique. And we have another one called Genesis, which is a rapid fire laser that heats the undersurface of the skin, again causing improvement in the acne scars. And the nice thing about treating acne scars is that patients are so happy with the results because they've been living with these scars, they're self-conscious, they feel the scars hinder them in, whether it's in their teenage years with dating or as an adult with business, they just feel these scars hinder their lives. And when they get rid of them or reduce them dramatically, it really makes a big, big difference in their self-esteem.
I can imagine. Let me ask you, Dr. Riopelle, what's the likelihood of a person who has acne, doesn't treat it properly and correctly, tries to go about it with whatever, makeup maybe for the girls, what do I know, okay? What is that person's chance to get acne scars and then have to live with it for a long time?
Now, are you saying if they don't treat the acne originally in the first place?
Yeah.
Right, okay. Well, if you don't treat the acne and you have acne cysts, you're probably going to get scarring. So ignoring those cysts and covering them up with makeup really is not the right thing to do because it will lead to scars, and those scars can damage someone for life or at least lead to treatment that gets rid of the scars. So really, the best possible approach to acne is prevention in the first place, getting the acne treated so that one never gets the scars. And we're quite good with treatment. We can prevent that cystic acne nowadays and prevent the scars from forming that'll hinder one from that point on.
Right. And do you think that when you do the acne treatments, the acne scar treatment, when you do it with your laser, is that painful to people? Is that, do they need to be all bandaged up? Does it take a day, a week, a month, a year, hospital? What does it take?
Right. Well, it depends on the type of treatment. None of the treatments are particularly painful. But depending on the type of treatment we do, some of them do have downtime, some don't. For example, the photofacial treatment that I was mentioning is a special flashlight like a laser that just treats the very surface for the browns and reds, and that's not painful, and it does not have any downtime. So a patient can walk in the door, have the treatment, walk out the door, go right back to work, and be in good shape. Other types of treatment are it may have a little more downtime. For example, the fractional CO2 laser does have a healing time, so we usually recommend that people are out of work for several days or off school for several days to even a week after the treatment, because the skin does get sort of red and peely during post-treatment time. So again, it depends.
So since that seems to be, to me, like, basically a surgery is always a wound. So is there a little wound created when you do this surgery, especially the fractional one where they have to stay home for a couple, 2-3 days?
Well, there is a wound, but it's a microscopic wound. It's almost like if you look at a lawn and you aerate a lawn, it's taking little plugs out of the lawn, but that's a small plug compared to the size of the whole lawn. Well, fractional CO2 is very similar to that, but it's on the skin surface. So we're making these little microscopic punctures with the laser into the skin, and you can't see them, but they're microscopically there, and then the skin has to heal in to heal those. So what you see instead is just some general redness on the surface of the skin as it's healing, but you don't actually see the little wounds. But it is making little tiny wounds in the skin. Yes, that's right.
Yeah. So,
right.
So it looks to me that maybe the hyperbaric chamber, which you have, which is for wound healing specifically, and brings oxygen to this area, where it brings oxygen to the whole body, but obviously to the area where it is heavily needed because of the wound healing, that may just speed up and make the wound healing better, faster, smoother. Yes? No? Maybe?
Well, it's certainly possible that could be the case, yes.
Wonderful. Okay, will you try it? Will you add that on to your repertoire, and will you put people into that hyperbaric chamber with those type of treatments?
Well, that's one of the advantages coming to us, is that we have a wide variety of things that we can do and ways that we can speed up the healing process and help patients to get the best possible result with the least amount of downtime.
Yeah, that is true. I have definitely noticed that by talking to you and having in your practice that you literally have you have it all, and all is maybe exaggerated, but you have a tremendous amount of tools. Because I noticed that every time in life, when you go and want to make a cabinet and you go to a carpenter, a shelf in your garage, well, he will put your wooden shelf in it. If you come to me, since some of my background is mechanical metal type of engineering, I'll build your metal shelf. And neither one of them might necessarily be the best. Either way, if you go to somebody who has a carpenter, a mechanic, a basket weaver, and God only knows what, a plastic guy, well, then you will get what fits the situations the best. And that's what it looks like, what you in your practice are having. You're having all the tools available, and obviously the knowledge to apply which one is the best for the situation.
Right. Every patient is different, and every patient needs personal attention and deciding what combination of things will work the best. And if all you have is a hammer, then everything looks like a nail. But in our case, we have many, many tools, and we mix and match those tools to find just the best result for the type of treatment to get the best result for each patient.
I love it. Thanks a lot, Dr. Riopelle. Bye-bye.
Okay, bye-bye.